Next year, parents who rely on Cincinnati Public Schools' health program may have to find an alternative. That's because the program could be cut if the city doesn't find the sources to pay for it. 9 News reporter Annette Pegler spoke with families who rely on the program, and she's here now with their plea to council. Annette?
Well, Carol, health officials told me that 75% of CPS students fall below the poverty line. Their parents can't afford to send their kids to the doctor, so they rely heavily on school nurses. That's why they are pleading tonight to keep this program intact. Lanisha Burney has 5 children in the Cincinnati Public School District. Last year, she received some alarming news about her 5-year-old daughter, Faith.
She has type 1 diabetes. It's the uncontrolled kind, and I found out September 2010. We didn't know she had it. She went into a diabetic coma.
Since that news, Burney has depended on the health services here at Winton Hills Academy to give her daughter proper care.
I have to do a calculation to determine how much insulin she gets.
Kathy Zix is the school health nurse at Winton Hills. She says her job responsibilities have grown tremendously. She also says oftentimes the nurses are a child's only connection to the proper health care they need.
A lot of my job is monitoring those kids, making sure that their medications are up to date, that we have plans to handle any emergencies with them.
When the news came that the program could be cut, many families became worried.
It could be the end for her. She can either end up seriously ill, or she could die.
They don't just put Band-Aids on cuts. They don't just take temperatures to determine if kids have fevers. They have a lot of crucial responsibilities.
Responsibilities that health officials say can't be replaced.
If they didn't have these services, you'd have even more children sick, more kids missing school. And what happens when you have a lot of sick, poor children? They become sick, poor adults.
Now, officials are reaching out to not only council for funding, but they are also reaching out to the entire community for financial support. This fall, City Council will vote on whether to fund the program. Carol and Clyde?